everyone else to step into either that same mission and talk about that same mission. I mean, what we get to do at Floyd Coaching is incredible because we share, or we just really are able to carry out the mission of helping people become the best version of themselves. And that whole concept started when Matthew Kelly wrote The Dream Manager back in 2007 and was on this mission to help people and organizations become the best version of themselves. And everyone on our team is like, that is that is what everyone in the world needs. Like everyone on my team truly believes every single person on this planet needs a dream manager, and every company needs a dream manager. So if you are interested at all in learning about becoming a dream manager or having a dream manager to help support you in your journey to become the best version of yourself and really achieve your dreams this year, please reach out to me. I would love to talk to you about that. And thank you so much for allowing me this opportunity to share with you. Thank you guys for going up and subscribing to my YouTube channel. I look forward to hearing any of your feedback, comments on the videos I've been creating for you to help you grow personally and professionally. And with that, I am going to turn it over to, I believe, Dr. Janie Lacy, correct? Or
Hi, Kate. Welcome back.
Hello.
It's good to hear your voice. And those flowers are absolutely for you. Why are they not for you?
Thank you.
Of course they are.
They're gorgeous.
Of course, they are gorgeous, just like you. So, of course, someone left them for you. So make sure you put them in water and you celebrate them today. And you're looking at them and say, absolutely. Whoever is admiring me, of course, I'm Kate Bowman. So,
you're awesome.
Well, welcome. I'm glad to hear your voice, and happy Thursday, everyone. Whether you are on any of the devices, I'm streaming live on multiple places, and I'm going to call this segment Therapy Thursday. So this next 30 minutes is going to be your therapy of the week, if you have not done so already. And I'm just so much enjoying the conversations this morning. I tuned in for Glenn Lundy's show as he was talking about Sophia. And I actually met Sophia too last November. So if you have not been to the Sphere in Las Vegas, what an awesome experience. I didn't hear him go into the details, but the 360 experience actually in the theater was also very impressive. So I saw postcards from the world, and just sitting in that theater, having a full immersive experience. I mean, there's nothing that can describe it if you have not experienced it. So when you're in Las Vegas, make sure you go meet Sophia and also go check out the immersive experience. And I saw postcards from, I know the concerts and all the things must be awesome in that theater. But as we sit here, today's the day after today's Thankful Thursday, but the day after Valentine's Day. And if you're not getting 2 dozen roses showing up at your doorstep, perhaps you had a different experience. Perhaps you were in a place where you're thinking about reflecting on the person who's not in your life, or the person you want to be in your life, wherever you are. One of the things I want to talk about with you today, and this was several requests that came to me earlier this week, and that's talking about depression. I know it's not a fun topic for many people, but there are people who are listening and watching who don't even yet know that they are going through what we will call either acute depression or major depression, or something that we call dysthymia. It's like a long-term, low-grade depressive state. And I want to be able to share this with you, and I want you to think about yourself. Whether we are breathing, because we are breathing, or someone that we're in a relationship with, or just something that we may be personally struggling with, and we feel like we cannot discuss it with anyone, because when we do share, that someone tries to come with their positivity, or they try to tell us what we should be doing. Sometimes I want to, have you ever been, think about this. Have you ever been at a train stop, right? So you're driving along, and you're coming up against a train stop, and the arms come down, and you're forced to have to stop, and you have to watch that train go by. And no matter if you're like, oh man, I got to get to work, I got to get to my presentation, I have somewhere to go, and this is a disruption of my life. So I want you to think about whether it's depression, whether it's anxiety, whether it's those negative, what most people consider negative feelings or experiences in their life, I want you to think about it as that train that's passing by. And I want you to think about you being in that car. You are the vehicle of the car, and the train, the emotions, all the things are just passing by. Because, Trisha and Raquel and good morning, Mindy and Tanya, just looking on Clubhouse, Fiona and River, and Kim and Terry and Dee, as I'm looking in the garden, and Candace, when we are experiencing these things, sometimes we just try to push them away because we think they're negative or they're bad or there's something wrong with us. But what about if we look at it as this is almost kind of like that train that's passing by that's forcing us to stop so that we need to examine what's happening around us or examine yourself to really give yourself a self check. And sometimes, James, when we are sharing with people and they're just immediately coming with their positivity, or they're saying, Christina, you have so much going on in your life. You have this and you have that. Well, I mean, why are you feeling this way? You feel judgment. And then you feel ashamed, Tosh. And then you think to yourself, well, I'm not going to share that again because I really now feel like there's something wrong with me because Mary Lynn is always laughing and having a great time and she's living her best life and I have all these things to be grateful for, but why do I not feel that way? And we can be in the right places and around the right people, but yet we can still feel alone. And we can learn to put on a fake smile. We can learn to just go with the flow, but we really are empty inside. So I want to take you on a little bit of a journey, and I want you to think about yourself, and I'm going to share with you things that you can help with someone that you may think is going through a bout of depression or they're pulling away. Because I do want to tell you, Ruth, that sometimes when we think about depression, even as I said the word to you this morning, where did your mind go to? Sometimes people have these stereotypes that someone's not getting out of bed. Yes, people have major depression and their symptoms manifest in different ways, Gail. So they may not be able to get out of bed. They may not do all the things that once were pleasurable. But most of us, and I do say us because there's someone right now that's listening or watching that this is you, that they're functioning. They're showing up on Clubhouse. They're showing up on Facebook. They're showing up on TikTok. They're going to work. They're answering their friends' calls. They're doing all the things, Ramona. So we think, okay, well, Ramona's strong. She got it. I'm not checking in on her. But this is an utmost very, very important topic because it's not just about our personal lives, but it's also in our communities. It's about recognizing the signs of depression, not only within ourselves, but within someone we love. And we have to understand how we can provide effective support. We didn't cause it, we can't cure it in someone else, but we can be a support system and we can be a presence, which is a present. And depression is more than just feeling sad or having a bad day, Kim. We look at it from a serious mental health condition that affects millions of people worldwide. And it can have not only a profound impact on the person themselves, but their families, their friends, their communities. But the person who's suffering, Judith, their thoughts and their feelings and their ability to function in their daily life, yes, we can see them going to work and doing all the things, but it's a struggle because the mental gymnastics can take somebody down, V. But how do you describe that to someone who you sign in on Clubhouse and everyone's rah rah and positive and killing their goals and crushing their goals and doing all the things? And how do you share that, Chris, when it may not be that for you? And as we were talking in the back chat earlier this week, most of us just connect superficially. So then if you really are suffering, and if Natasha sends me a DM and says, well, Dr. Lacy, how you doing? And I really don't know Natasha that well, my immediate response is going to be, I'm good. Thank you for checking. So today, and make this a goal for this year versus just kind of going through life, crushing goals and being task oriented and getting information and keep going. Make it a goal, maybe to connect and to start building a relationship with one person a week. If you can't do one a week, do one a month. See Terry and Consistently like Terry's post, comment on her post, send her message every once in a while. Find out what city she's in. When she's in that city, meet her for lunch, as I know a lot of you do. But recognizing depression can be so challenging because it manifests differently in different people. The way that it may show up in me may be very different than the way that it shows up in TM or Rocky or Kate. Because some people do experience this persistent sadness and there's feelings of hopelessness that we can look at their life and think, oh, they have it all together, but they feel hopeless inside and there's nothing that I can say or do to take that away from them. Or it could be that loss of interest in the activities they once enjoyed. And if you are in someone's circle, you will know if they're no longer doing the things that you know that they once enjoyed, because you are relational. You know what people are doing in your life. You're not just transactional. Because if we're transactional, we have people in our life because of the transaction or the benefit that they bring to us. But the greatest gift is the relationship. And I do believe that we need to bring back our communities. You know, I live in a subdivision and I look around at the different houses and all the things that are people around me. I barely know the people that live like I can see them out my window, so to speak. Right? But when you think about like in Africa and India, the elephants, when they're having their babies, all the other elephants come around them as they're having that baby, the power of community. But now when we have babies, right, especially as women, we're in there with the doctor and maybe one family member, and then baby's thrown in our hands, and then off we go to figure it out, so to speak. So let this be the year of bringing back our community, getting to know each other one by one. Because other people, when they're experiencing depression, they may experience things like we diagnose, right? We're checking people's, as a licensed therapist in Florida, checking people's appetite, their sleep disturbances, there's their constant fatigue. We're doing certain types of checks and taking a self-report from them. But there are some common symptoms that I do want you to look out for. So do you have this persistent sense of sadness or emptiness, and in your mind you're thinking, well, why do I feel this way? There's no reason for me to feel this way, and it's not necessarily tied to, you know, you breaking up with someone yesterday on Valentine's Day or being lonely, but it's just kind of persistently there, this feeling of sadness or this emptiness that you don't even know how to describe, that you can sit alone at times and just emptiness just comes over you and you're like, oh. But as I believe TM said this morning, like it's hard for people just to kind of sit and do what the things that they need to do, because then we distract ourselves, as he mentioned, with the laundry or the things I need to do. We busy ourselves, and busyness at times can be a trauma response because we're distracting ourselves because we don't want to feel. And if we don't want to feel, then we cannot deal with the stuff that's inside of us. Or no matter how much we do the inner, how much exercise we do, or we're eating all the right foods, as we're talking about the blue zones, and we're doing all the things to want to live a healthy life and to live a long life, but yet we still feel this lack of energy or this constant fatigue that's just constantly riding with us. We're taking all the vitamins, we're trying to sleep, we're doing all the things, but we constantly still feel fatigue. That's not caused by any type of mental medical conditions. Or what about you're at work, Sonia, and you keep having to read that paragraph over and over and over again. And I'm not talking about being diagnosed with ADD or ADHD, but you cannot concentrate. You can't make decisions. And you're doing the mental gymnastics, just trying to make simple decisions in your life. Or it could be those changes in your sleeping habits, such as insomnia, or you're oversleeping, but you will rationalize it away. Oh, I'm just tired. I just need more sleep. Or what about that noticeable change in your appetite or weight, that you're losing a lot of weight or you're gaining a lot of weight? Because sometimes people can emotionally eat, as we hear, because they're coping with something that they have yet to describe that's happening in their life or in their body, Wendy. That you truly used to enjoy those Twizzlers as you're watching your Netflix. Now you can't even eat those Twizzlers. What about that loss of interest? You used to come to Clubhouse or you used to check on Facebook and join the lives and all these other things, but now you can hardly do it because when you're hearing someone in their rah-rah nets and they're crushing their goals and telling you what you need to do, you feel like there's something wrong with you because you're like, I know I need to do these things. Sharon, you're like, I know I need to do these things, but what is wrong with me? I know all the right things I need to do, but I just can't get myself to do them. And I'm so ashamed to tell Malcolm that I have not met those goals because I know I'm supposed to be accountable, but I feel like there's something wrong with me. So then what you do is you start to isolate yourself because you don't want to be judged by someone because you really feel like they don't understand you because when you do reach out to them, they're either telling you what you need to do or they're telling you how great you have it, Sam. And then Susan doesn't need that at that moment. So then she continues to isolate herself. And then people tell her, well, you have a daughter, you have a son, you have a family. And then they feel even more guilt because they're thinking, well, I should be living for my children, but I really feel like I can't. So we have to be really careful, Josh, that when someone comes to us in a place of vulnerability, the messaging that we give back to them. And I will tell you, Teresa, sometimes we don't have to give any advice. We don't have to tell somebody what they need to do. We don't have to tell them what we did when we were in depression. We can just say to them, Mary Lynn, it's okay that you're feeling this. It's okay that you're going through this. I'm here with you. I'm here. You don't have to do this alone. But yet, sometimes we have yet to deal with the stuff that we are struggling with in ourselves. So that's why we are so quick to dismiss, even though we don't know we're dismissing someone else's feelings because we've yet to deal with the stuff in ourselves. And it makes us feel uncomfortable when someone comes to us in a place that, oh, we don't know how to deal with. Or we think, wow, her life looks so great. Why does she even feel that way? So if you notice any of those signs in yourself, or maybe a loved one, or maybe someone superficially at work, I want you to remember this, and I want you to remember this very, very clear. Depression is not a sign of weakness, and it is not a character flaw. Let me say that again. It is not a sign of weakness, or it is not a character flaw. If you want to embrace the happiness and the joy, which is that also that train that's passing by, it's not going to take residence in your house, so to speak. The same thing when it comes to depression, anxiety, feelings of sadness, moments of feeling down, or moments of on Monday when I went back, someone had sent me Glenn's segment on Monday. And when Glenn had shared those moments of him saying, why not me, Lord? When is this going to happen for me? I know that there are other people who feel that. And there is nothing wrong with you. It's the train that's passing by. It's not going to take residence, but we have to pay attention to it so that we can truly deal with what we need to deal with, those warning signs that's happening in us. Because depression is a legitimate health condition and it does require professional help. So let's discuss what we can do to support someone who may be suffering from depression. And this segment is only for informational purposes only. I'm not your therapist, even though I'm your resident therapist. This is just for informational purposes only. So take what resonates with you. The first thing I want to tell you that we can do, you can do, if there's someone that's going through a low season, is what I'm going to call it, or they're maybe not showing up as their best, is I want you to listen and to validate. Be what you needed to be when you were down. Some people tell me, well, Dr. Lacy, I go and isolate. I just take a time out. Well, not everyone's you. Some people are still functioning and going to work and they're doing all the things that they need to do because that's their cover up. So I want you to listen and validate. One of the most powerful things that you can do is listen empathetically. And validation does not mean you agree with their perspective. Let me say that again. And I get this a lot, especially in my couples therapy. If you're listening to your spouse or you're listening to your partner, doesn't mean that you are agreeing with their perspective. It's just saying that I'm acknowledging your feelings and your experience. I see you. So, one of the most powerful things you can do, especially if someone is reaching out to you, and on many of the social apps, if someone's reaching out to you in your DMs, ask them, when can I get on the phone with you? I'd love to hear your voice and listen empathetically. Curb your interruption, curb your compulsion to want to give someone direction and tell them what they do to try to make it go away. In group therapy, I run a lot of different group therapies in these situations, especially through my Women Redeem, where a situation where someone starts crying, and people's immediate reaction is to grab the tissue and give it to them. And I know people are being helpful, but I also know metaphorically they just want them to stop crying because it makes them feel uncomfortable. So validation doesn't mean you agree with their perspective. You're acknowledging their feelings and experiences. Number 2, express your concern. Some people feel like they're afraid to express their concern because they don't want someone to reject them, or maybe I'm wrong. Maybe I'm wrong that Rocky is going through something, so I don't want to be wrong, so I'm not going to express my concern for her. But I want you to clearly express your concern without judgment. Use I statements such as, Rocky, I've noticed I haven't seen you. You've not been doing your, I'm making this up, everybody. You haven't been doing your segments. You haven't been posting a lot. I just want to check in with you. I'm a little concerned about you. Right? Just express your concern and use your I statements. 3, encourage professional help. So if I'm talking to Mary Lynn and she's telling me, Mary Lynn has not told me this, just an example, that, I just haven't been feeling myself, Dr. Lacy. I just have not been feeling myself. I just don't feel like getting up in the morning. I just feel like I just need to stay in bed. Right? It's okay that as Mary Lynn's friend or associate, I can say, have you ever considered, or let's say I'm Rocky and I'm saying, well, have you ever considered maybe getting some recommendations from Dr. Lacy? I've gone to therapy and I've had that sacred space, and where I can just go in confidentially and talk about all the things that are happening inside of me, and getting some guidance. And therapy has really helped me. Right? But number 4, I want you to be patient. And I know I say this and it may sound simple, but think about this. If you've ever been on a journey, doesn't have to be you, this could be your friend. If you've ever been on a journey with a friend or someone that you love dearly or has been close to you, whether you say it or not, you want them to get to the other side. You're like, man, I just can't wait to TM sees his potential and he's rocking. I just can't wait because I see all these great things about him. I just want him to get to the other side. And then what happens is TM can pick up on that energy. And then again, we're not doing it intentionally. Let me say this. We're not trying to harm people intentionally. At times we are really thinking and trying to be helpful to people. But at times, by not being patient, we can also be creating more harm, meaning that they can isolate themselves. Teams like, oh, I'm not talking to Janie anymore because I feel like she just doesn't get me. So I want you to be patient.
Too much pressure, Dr. Janie, too much pressure.
Too much pressure to show up and arrive, that he just feels like he can't just sit in that space. So we have to be patient. And we have to remember that recovery. It's easy when we look at someone who's recovering from addiction or substance abuse or alcoholism, that we know, we can say it all the time, that recovery takes time. But the same thing when it comes to depression, it takes time. And each person's journey is unique. It's going to be important to be patient and supportive through their process. And remember, their process. And if you can't be patient, then you need not be the one riding with them. And I say that again, because sometimes you're doing more harm by trying to ride with somebody to push them through than truly just being there with them. Because we collectively, that's our strength, is by being patient and not trying to push our process onto someone else. And being strong also means that at times, Janie can say, well, maybe I'm not the good friend. I'm not the best person to be there for Tosh, but I can nudge her to reach out to Mary Lynn because I know Mary Lynn will probably be much more patient than I. Right? Just using that as an example. Next, stay connected. How many of your friends on all these social media apps are truly your friends? Right? We have this illusion that we are in community. We have this illusion that we have all these friends. But how many of us have people really reaching out to us? How many of us have really are connecting with people offline? I know some of you are, right? Got the pleasure of hanging out with Mary Lynn last month or in December, all the months together. But how many of you are really connecting? Because depression can lead to social isolation, and especially on social media where we have this illusion that we have all these crew and all these friends. But who's coming for me? Who's coming for me? When Dr. Lacy disappears, who's checking in for me? Right? So sometimes we think we're connected. Suppression can lead to social isolation. So keep reaching out, even if they don't respond. Let them know that they're there for you. I sent you several messages, Michelle, and I know you haven't responded, but I just want to let you know when you get a chance, I'm still here for you. Keep reaching out, especially if they are someone that you know is not going through the best of times. Lastly, and I want to open this up because I do want to hear from some of you in our last couple of minutes on Clubhouse, is take care of yourself. Supporting someone with depression can be challenging. So it's essential that you also take care of your own mental health, especially when we are connected with someone and we love someone. Their mental health can affect us. We can't change what they're going through, but if you are riding with them, you got to take care of yourself so that you can better be there to support them. Because depression is a very complex condition. So you understanding its signs and knowing how to offer support can make a significant difference in someone's life. And it's important to remember if there's something I said this morning or you're replaying something on any of the apps, I want you to know that you're not alone. There are many, many people, millions of people that suffer from depression. And it starts setting in right about now. Because now, early in the year, they're thinking, oh man, it's already a month has passed. I haven't. The pressure, as TM says, that we not only get from other people that we put on ourselves. We got to run our race, folks. I can't compare my race to Gail's race or Trisha's race. I got to run Janie's race. And there are resources available, professionals ready to help you. There are communities of people who understand where you're going through. If you have suicidal thoughts, dial 988. Remember, it is okay to ask for help and it's okay to offer help. We are all human and we are all in this together. All right. Thank you for listening. And I hope that something resonated with someone. If it's not you, it's someone that's around you. 1 out of 3 people right now. Look at, if you're on Clubhouse, the little circles around you, even though they may not say it, someone right now is suffering from depression. And something I said is making their stomach turn. But yet they're still afraid to ask for help. So I want to hear from, we have about 3 minutes, and I want to hear from 1 or 2 people on Clubhouse. Open your mic. What resonated with you?
Wow, what a powerful segment. Dr. Lacy, that was so enlightening. In fact, just recently, as recent as this week, my own father gave me a quick call and said, hey, I need your help with something. He's 79 years old. He's getting ready to be 80. And I think that age coming up upon him is giving him a little anxiety. So he asked me to organize some things like his medications and things like that. He's a Vietnam vet, by the way, and he does have some PTSD, excuse me, but he's very high functioning. So it doesn't impact his everyday daily life. But just recently, of course, because of the holiday season and winter season, he gets a little melancholy every now and then in the winter because he's not as active and it's not sunny outside, and he loves being outside and being active. But when it's rainy or cold during the winter, he's just not as active. So he called and asked that I would help him get things in order because he's forgetting little things. He said, I'm getting old now and I'm forgetting things. But what I noticed was he just really wanted the communication with me. And then he asked, will you help me? And hearing those words come from my father, those 3 words coming from my father was so profound. I was just like, oh my goodness, he has never, ever He has always just been this pillar of strength. And he's still very mobile, still drives, still does everything for himself. But just hearing those words, I was just taken aback a little bit. But again, just like you pointed out, you never know. And it's those things that is not spoken in between those little comments, such as that is just very telling.
Yes.
When people are communicating in various ways and various things, that, you know what, I need your help. So every single day he calls, and every single day, and I'm only 2 doors down, by the way, so it's very easy for me to get to him. But I have just been popping in and checking in and just sitting with him.
Awesome. That's awesome, Ramona.
So that was just a great example. I was thinking about that as you were speaking.
It's so awesome.
Great segment.
Yes, I appreciate you sharing that, Ramona, because some people don't directly ask for help, but you responded and you're there for him. And you just even said the insight is that was his way to get connected with me. And you responding to that and being consistent going forward is going to be important. So I appreciate you sharing that. And I know there's a few other people that wanted to share, but if you want to go ahead and just put your comments in the chat, or if there's something specific that you want to share with me, the best way to reach me would be through Instagram, and you can direct message me. I'd love to hear what you wanted to share if I was not able to today. So remember that depression is not a sign of weakness. It's not a character flaw. And I want you to really remember that every step that you take towards understanding someone else, as Ramona shared in her story with her dad, and showing empathy can make a world of a difference. So this is Dr. Janie Lacy. And until next time, I want you to reach out to a friend. But until then, I'm turning it over to Lolita Walker. Good morning, Lolita.
Good morning, everybody. I am so excited.